Hi, my name's Amy. I'm here to tell you guys about my past year, which has been pretty turbulent. It's basically, for those that don't know me, I was pregnant last year with my first child, so I had a boy. His name's Theo. He was born in November 2016. He was 2 weeks late, so apart from being really big, my pregnancy went fine. But because it was 2 weeks late, I ended up having him by C-section on the Saturday. And then I just remember feeling really tired because it was like 10 days of labour. What most of you don't know is that 3 days after, I had a stroke and a bleed on the brain, which kind of dampened both in a sense. Also, Theo had an infection, so he had to stay in the original hospital I gave birth in, and I had to move to another hospital because that's where the nearest neurosurgeons were. So I didn't get to see him for the first week either. So it was all a bit turbulent in the sense at the time. So I think they tried to find out the cause of the stroke. So lots of scans and tests and stuff, and eventually they decided to do an angiogram, which is where they inject, I think, a gold liquid through the groin, and it makes you feel really warm, and you also feel like you've peed yourself a little bit embarrassing. But basically it highlights the vessels in the brain, and it turns out that I've got a disease called Moyamoya. So, Moyamoya is a disease where the vessels in the brain, they, rather than just staying thick so the blood can flow to the brain, they go from thick to thin. Or in my case, some of them go from thick to thin to thick. So, that was the reason why I had the stroke. So, I don't know whether I was born with the disease. I'm guessing I was. But basically on the angiogram they show scans like that. So that's what it looks like if you've got Moyamoya. On an average person it should have a lot less going on. But like the literal translation of Moyamoya means puff of smoke, which it does look like. It's a Japanese disease, it's quite rare. I think it affects about 60 cases in the UK per year, about 100 in the USA. So yeah, it's pretty rare. Predominantly used to affect Japanese people, but now it's affecting a lot more races, so like Westerners and Chinese and Africans and stuff. So the reason why I want to do this video is to raise awareness and what the options were for me. So the main two options that you have are an indirect bypass and a direct bypass in the brain. So when I saw the first neurosurgeon, he said do indirect, but because the disease is so rare they like to confer with the neurosurgeon, so he suggested some in London. He also suggested my neurosurgeon, who's Mario. He's based in Bristol. My husband had heard that Stanford would have a Moyamoya centre, and that's where he worked for 2 years, so it was like, okay, let's go and see him. So I had a second angiogram done, and he said, yeah, definitely have Moyamoya. He suggested direct bypass. I think, in a sense, it probably made more sense because direct, I think, works better in adults, whereas indirect works better on kids. But, so I had all the tests and stuff, spec tests and things, and I was booked in for my surgery on the 11th of October this year. So 4 weeks today. So he said to do the right side first because it was worse. So they did a direct bypass. So they basically cut open the scalp, draw a hole in the skull and connect a vessel directly to the brain. So it's got a direct flow of blood permanently. And they also have to lower your body temperature to 34 degrees. So apparently it's better. And I think it's safer for the brain. All in all, operation was successful. it took about 8 or 9 hours. So it's a long time to be put under. And also said that there is a small chance of having another stroke in the first 48 hours of the operation, because obviously the brain's been deprived of blood and now it's got a new blood flow. So they were quite crucial. You have to have a catheter, cannulas and stuff. And it took me about 4 or 5 days to feel normal afterwards. So I had that done on Wednesday. By about Sunday I felt a bit more normal. Then I was booked in to have my second side on my left side on the 17th, which is Tuesday. So that's 3 weeks yesterday. But he just said, we're going to open you up and see whether I need an indirect or direct. So eventually he said they did an indirect one because there was enough blood flow. So that's where they do the same. They open the skull and they lay the vessel on top of the brain to encourage more vessel growth. So then hopefully it carries the blood down into the brain and encourage more blood flow, basically. So that went well as well. First 48 hours, again, there is a small chance of having a stroke. I think it's under 5%. So, yeah, didn't want one of those again. But you kind of recover a lot quicker after the indirect, because it's, I think, an hour or two shorter than the direct one. So by about 40 hours, I was feeling kind of normal. So a bit sore on the scars. Used dissolvable stitches, thank God. But if I show you the scar, so that's the right side. So it's pretty good. I think the left side's not so clear, but that's the left side stitch is there. So it didn't shave that much hair off, which is really good. And you kind of feel like a dull ache to start off with, which isn't surprising considering what they've done to your brain and your skull. But apart from that, you just feel really tired. Like, I felt knackered all the time, so I was taking like 2 or 3, 4 naps a day, which is good because obviously that's you recovering. And by the time I got moved from the ICU to the ward, my tongue went numb. So I couldn't talk, but I could understand what everyone was saying, and the doctors and nurses. I could do everything they asked me to do, you know, like close your eyes, push them away, pull them towards you and stuff. But I just couldn't talk, and that lasted about 20 minutes. So I think tongue numbness can affect around 15 to 20% of people after the operation, which is normal apparently because the brain has to get used to the new blood flow. So he just said I need to drink loads of water. Also recommended to drink isotonic drinks. So at the moment I'm drinking up to like 1 or 2 bottles a day. Whereas before I had to make sure I drink at least 2, along with water, tea and stuff. So you do end up going to the toilet quite a lot, but it's just obviously to help the brain and stuff. The isotonic drinks are better because they retain the salts and stuff a lot better than the water and tea. But, you know, make sure everything's okay. And I think the tongue numbness lasted about 2 weeks. So I think I'm on my 6th day of no tongue numbness now, which is really good. I used to have them up to like 1 to 4 times a day. Longest one I think was about an hour. Sure, they got shorter over the time. So the first week was a really long time for it to get back to normal. The second week they kind of came in like 5-10 minute segments. I could still talk, but not very clearly. Just had to wait really, drink some water when I could, and then just wait till it went. So, yeah, thank God that that's over with, but still feel a bit tired. Sleep quite a lot during the night. So I'm having less naps now during the day. If anything, I'll have like 1 nap a day. But yeah, it's not bad. Didn't wash my hair until like 19 days after the first surgery. So by then it was really itchy and gross. So it just said to make sure that when you wash your hair, don't go mental. And obviously just make sure you dry the scars to prevent infection. But yeah, I'm doing the video because I want to raise awareness for Moyamoya. It is rare, but it's not so rare that people don't get it. I think after the stroke, I've been left with, I can't feel this part of the cheek. I can feel my tongue now, which is good, and I can't feel like the ends of my fingertips of my left hand. Apart from that, everything's okay. I couldn't really speak very clearly, or I sounded really different in my own head to begin with, so I had a speech therapist. I just remember the physio coming around the hospital saying, tell me how many words you can think of begin with that S in a minute, and I could only think of 2 or 3, which is really shocking. Apart from that, I don't really remember much from giving birth. Like, I remember being in hospital, don't really remember the stroke, or being able to move my left arm. I kind of remember having Theo after a week and being put in a private room, going home and stuff. But apart from that, it's just, yeah, my family obviously saw me, and that was good, and my friends. But I want to say a big thank you to Mario for doing the operation. It's not a cure, there isn't a cure, but it would hopefully help me delay or not have another stroke or bleed in the brain again. So by choosing to have the operation, I've already extended my life, like the quality of life. Because without it, you know, your chances of having the stroke go up by about 5 to 10% a year. So this year, maybe not. Next year, maybe not. 3 to 5 years, I probably would have had another stroke. And who knows whether it would be minor or major. I could still have another stroke. Hopefully not. I've got to keep going back to have angiograms. So in 6 months' time, just to make sure everything's okay. But the CT angiogram was fine, MRI was fine, haven't had any more strokes. So, all in all, I feel good. What I would ask is if all of you guys can share this video, because I think people need to know about this. People have strokes every day for different reasons, and this is one of them. There is a website that Mario has done, which is ukmoyamoya.org, if you want to find out more information. He's worked out statistics and stuff of like comparing indirect and direct, because they're the main options you have anyway. But apart from that, I feel good and hopeful. But the Bristol Hospital are trying to create a Moyamoya centre, which is good because I think people need to know that they have options and places to go to. There was another girl who had Moyamoya actually at the same time, so I think he did her operation first. She had 2 direct bypasses and she was only 18. So it's a bit shocking, really. So hopefully here's to a stroke-free future, and please just share this video. I'd really appreciate it. Thank you.